my name is Morgan. I'm going to be your nurse today. I'm just going to do hand hygiene. Can you verify your name and date of birth? Awesome. I'm going to go ahead and check with the wristband. Everything looks good. Okay, so today we're going to be changing out that inner cannula of your trach, and then I'm also going to be cleaning around it if that's all right with you. Awesome. I'm going to go ahead and lift my patient to a good working height. While I'm doing this, are you in any pain at all? No? Okay, great. Okay, now that my patient's at a good height, I'm going to go ahead and take a clean dressing. I'm just going to put it underneath that trach so I don't get anything on my patient. Okay, and then I'm going to go ahead and I'm going to open up my tracheostomy tube. I'm going to go ahead and grab the outer edges. I'm going to put the shiny side down. This will be nice. Sterile field. All right. So I'm going to go ahead and I'm going to dump this out. So this will be everything in here. I'll for right now. Go ahead, do this. I'm going to go ahead and put my sterile saline, one in here and then some in here as well. The purpose of this is I'm going to go ahead and use this as my dirty water, which I will clean it with, and then I'm going to go ahead and put that inner cannula in a clean water and let it sit in there for a little bit. So I'm going to go ahead and start off by applying some clean gloves. Alright, so since all this is going to be clean, nothing's going to be touching that inner cannula, I'm going to go ahead and I'm going to be able to touch this. My spoolie, and I'm just going to go ahead and set it in the water, and then I'm going to go over and I'm just going to tell my patient I'm going to unlock and I'm going to take out that inner cannula. Once I grab that inner cannula, I'm going to go ahead and dip it in this water, sterile saline. I'm going to go ahead and use that spoolie, go in and out, making sure it is all clean. Put it in here again, do that one more time. And then I'm going to go ahead and dump it in my clean sterile saline. So after I'm done with that, I'm going to go ahead and I would put new clean gloves on just because I was touching something that was dirty. So I have my new clean gloves on, and I'm going to go ahead and put some sterile water in this little sterile saline in the little basin. And after that, I'm gonna go ahead, and at this point, I would have another nurse with me assisting me, but I don't have one right now, so I'm gonna be doing this by myself. So I'm gonna go ahead, I'm gonna hold onto that faceplate, I'm gonna go and grab the gauze that is underneath, I'm gonna throw this out. Okay, and I'm still gonna be holding on, and I'm gonna go ahead and grab cotton swab, and I'm gonna dump that in the sterile saline. And I'm gonna go ahead around the front of the faceplate, and I'm going to be cleaning around, see if there's any gunk, get everything clean. Okay, then I would discard this. And at this moment, I'm going to go ahead and grab my new string. I'm just going to set this here. I'm going to start on the outside, making it easier for myself. I'm going to go ahead and take out this. I'm going to grab it from the other side, but I'm going to leave this side in. I'm going to go ahead and grab another cotton swab, dip it in that sterile saline. I'm gonna go ahead and clean under the whole faceplate. So I'm gonna start on the left side of my patient, clean everything underneath, clean in here, and then I'm gonna come over here, clean all behind, making sure I really get everything. All right, I'm gonna go ahead and discard of this when I am done. So once I'm done cleaning it, I'm gonna go ahead and put my string in this side of patient's plate. Okay. All right, and then after that, I'm gonna go ahead, pull it through a little bit, and trying to still hold on. Again, I would have another nurse with me that would be holding onto that faceplate. I'm gonna go around and grab this. And since I already had decided to clean this side, I'm gonna go ahead and take out that dirty, and I'm gonna go ahead and throw it away. And then I will take this side and put that through, and then go ahead and tighten tighten it. Now that I'm done with that, I'm gonna go ahead and take my pre-cut gauze. I'm gonna put it through down here because it'll take some of those secretions away, just making sure everything's all clean. And I will loosen those ties a little bit for it, still making sure my trach is fastened when I'm done. So now that that's in there, I'm gonna go ahead, fasten that trach, making sure it's not too tight, and then I would go ahead and tie it, making sure that it is all snug. Okay, after I'm all done with that, I'm going to go ahead and take off my clean gloves, and I would go ahead and discard of those. After I'm done with that, I'm gonna go ahead and apply my sterile gloves so that I am able to put in the inner cannula again. Once my sterile gloves are on, I'm able to go ahead and grab that cannula since I'm all sterile. And I'm not gonna touch anything. I'm just gonna make sure that it's all dry, or as dry as I can get it. And I'm gonna go ahead and tell my patient that I'm gonna be reinserting that cannula. All right, and then I'm gonna make sure that it is all locked in place. And once I make sure it's all locked in place, I'm gonna recheck, make sure all the gauze is in the correct place, make sure that my ties are not too tight. I'm gonna ask the patient how they're feeling, if they're in any pain, and if they were in any pain, I would go ahead and check their PRN medications to see if there's some pain meds that I can give them. If there are, I come back, assess 30 minutes later. But after that, I just document everything, document how the procedure went, and then I'm gonna go ahead and lower my patient back down and clean up my workstation, and that'll be it.